I moved to South Africa because I'm a trauma social worker, and I was interested in learning from their peace process about community healing modalities related to trauma. So I was studying that at University of Cape Town. I've been a lifelong sinus infection sufferer, and I had a sinus infection that just wouldn't resolve. I was diagnosed by an ear, nose, throat doctor there that I had cancerous polyps in my nose, and so I had to make a very difficult decision about my health care, about whether to stay in South Africa or come back to Chicago. And I had friends who were nurses and also physical therapists at Rush who said, you must come home and you must go to Rush and you must see Dr. Batra.
My encounter with Maggie initially was very unique. We were just emerging from the very initial phase of the pandemic when everything had been shut down. Depending on the aggressiveness of the tumor, the stage, there's a variety of options that can be available, from surgery initially to radiation and chemotherapy up front, followed by surgery afterwards. So we take a lot of different factors into consideration when we make those critical decisions for the patient.
But what I do remember is coming away with a feeling that he was the right person for me, and that I knew that immediately. And I had no qualms of moving back to Chicago and going right to Rush.
Margaret knew that this is what we do. We have a very comprehensive skull-based team, and I was going to get her connected with Dr. Byrne, my neurosurgical partner, and also get all the appropriate imaging studies. We're kind of built for this, so she knew that once she got here, we were going to be able to activate her team quickly to get her taken care of.
We wanted Margaret and all of our patients to know that we have a very experienced skull-based team here that works together in a multidisciplinary fashion, that we have all the technology, the experience, and excellent outcomes.
Dr. Byrne and Dr. Batra explained what was happening to me as really this intersection between my sinuses, which needed to be reconstructed totally, and the skull base that was quite concerning at the same time. And that both of Dr. Byrne's skills and Dr. Batra's skills were really made to coalesce during the surgery.
With all of these cases, when we convene as a tumor board, we look at all the different pieces of information, we review all of the imaging studies, we review the pathology, and then really gathering input from colleagues that are surgeons there, medical oncologists, radiation oncologists, everybody that's in the room to collectively develop the best plan for Margaret. I'll start out initially and do the sinus work, prepare the skull base, create the right axis for the tumor resection. Then Dr. Byrne will come in, he'll work from one side of the nose when I'm on the other side of the nose.
So after the sinus portion of the tumor is taken out, the part that goes up into the intracranial space is then addressed by the neurosurgical team by literally drilling out space around the tumor at the base of the skull, all the way down to the separating space called the dura. We open that up, and then we deliver the tumor down from the intracranial space away from the brain in a way that protects the brain, lessens the likelihood of bleeding, and assures that we've gotten back to normal tissue and that we're likely to get to cure.
What I always tell patients is it's going to be 4 eyes, 4 hands, and 2 brains, which is better than one person doing it. And then we're working together until the tumor resection is done, and we'll start the initial part of the reconstruction together, and usually he'll transition back to me and I'll complete the reconstruction.
Dr. Batra and Dr. Byrne were able to pull out the entire tumor. So my recovery has been recovering from radiation and recovering from such a massive surgery. So I'm still a year and a half later recovering from that, but I'm doing great.
What makes skull-based surgery at Rush different is right now we're the market leader and our team is experienced. And we've been working well together for a long time.
Today I'm doing very well. I still get tired very easily. I'm at Rush a lot, but it's because I'm doing a lot of holistic medical care. In particular, my palliative care team became a very strong mental health support for me. Getting treatment at Rush really always felt like I was getting the very best care that I possibly could. When I was at my lowest lows in cancer, people don't always say the right things, but people would say to me, "You have the best care on the planet," and that would always make me feel better. And I also love the ethos of Rush, that they take Medicaid patients and they're just as important as anyone else.
You know, I've been doing this for almost 20 years, and you develop a soft spot for patients and you realize what they go through and the challenges. And Maggie's really been a model patient. She is informed, she is engaged, and really takes ownership of her care, but knows how to partner with the physicians that take care of her.
What I think about when I think about Dr. Batra and Dr. Byrne is everything they've had to do to get where they are so that they could help me. Thank you for saving my life. If I moved anywhere, I would come back for visits with Dr. Batra. There's no way I'm letting Dr. Batra out of my life.